Well, thank you so much, Chairwoman Wasserman Schultz, and thanks to you and the committee for holding this hearing today and for giving us the opportunity to talk about what we are seeing at home in our districts. I am glad to be here with you and with one of my favorite classmates who so beautifully and articulately expressed the vision from her district, which I am hearing in my own district in Houston. And I know that many of our colleagues have raised their concerns today about the Republicans' failure to extend the enhanced premium tax credits. In my home state of Texas, the cuts to Medicaid and the refusal to renew the expiring healthcare tax credits will mean hugely increased healthcare costs for all Texans, for every single person in our state, as they will for people across the country. It is estimated right now that Texas will have the highest loss of coverage of any state in the United States. If these tax credits expire, people in my community, like communities across the country, could face higher health insurance premiums, loss of health insurance coverage, delayed care, increased uncompensated care in our hospitals, and so much more. And many of the people that I represent have wanted to let people in Washington know how disastrous this will be for our community and for people across the country. And they have been coming to Capitol Hill for months and months since we were debating the big, ugly bill, talking about how disastrous these policies are. And so I want to make sure that you hear from them today. And many of the people that I have the privilege of representing work in the Texas Medical Center, which is the largest medical center in the world. It is home to some of the greatest minds in medical research and medical care. It employs more than 100,000 people. It has 10 million patient encounters every single year and a GDP of $25 billion. Last month, the Texas medical institutions gathered together, as well as the Greater Houston Partnership, which represents the business community in our 12 county region in Houston and Harris County. And the medical center institutions sent letters to me and to every member of our congressional delegation, Republican and Democrat alike, outlining their concerns about the impact of the expiration of the premium tax credits and what it will mean for our community. And I would love to introduce the entire letter into the record of the hearing. And
Without
just
objection.
terrific. I would love to give this letter and just to share with you one example that they gave here of many. They said to every member of our delegation, the consequences of the tax credits expiring would be devastating. If Congress doesn't act, a Texas couple in their early 60s could see their annual premiums rise by more than $17,500, more than tripling their out of pocket costs and placing coverage out of reach. The affordability cliffs would lead to coverage losses, delayed care, worsening health outcomes for our patients. There'd be higher uncompensated care costs, overburdened emergency departments, and greater resource strain across our networks. And the Greater Houston Partnership, as I said, which represents the business community and leading institutions in our region, also sent a letter to our congressional delegation supporting extending the enhanced premium tax credits and pointing out that of the nearly 3.5 million residents in a variety of industries in our area, nearly 1/3 of those workers are able to remain healthy contributors to our economy because of their ability to access affordable healthcare coverage through enhanced premium tax credits. These tax credits have provided business owners and employees alike with much needed stability, empowering entrepreneurship and economic growth. And our partnership has asked us to make it a priority to extend these tax credits. What we know now is that the estimates are that more than 1 million Texans could lose their coverage without an extension of these credits. And in my district alone, it's estimated that 125,000 people will see their healthcare costs increase as a direct result of the failure to extend these credits. So it is critical that Texans and all Americans have access to affordable healthcare, and it is clear that the enhanced premium tax credits expiring will be devastating, not just for people in my district, not just for people in Texas, but for people all across the United States of America. There's so much at stake, and that's why it's so important that we're here. It's so important that our colleagues on the other side of the aisle return to Washington and work with us to address this crisis that we've heard from at home. Republicans and Democrats alike, voters and constituents are telling me that they want us to solve this problem. I'm glad that we as House Democrats are here working together to do that, and I thank you for the opportunity to share these stories with you today.